everyone, and welcome to your next lesson, which is Unit 6, Introductory Awareness of Health and Safety this time. Okay, so for health and safety, we are going to look at a few different learning aims. So we're going to look at the main responsibilities of workers and employers for health and safety. We're going to look at the importance of assessing risk in relation to health and safety, understand the importance of key areas of health and safety, and understand what contributes to the reduction of the spread of infection. Okay. So if you go to your booklet and go to page 65, which is Unit 6, Introductory Awareness of Health and Safety. So on page 67, you've got your first question, which says, question 32, outline 4 key areas of health and safety related to a work setting. Okay, so there is a poster on health and safety that we'd normally give out at this point. And what it is, it's just the health and safety law, what you need to know poster. Now this poster has to be displayed in every workplace. It's usually displayed in sort of staff rooms or on some sort of corkboard or something, like a memo board, somewhere like that in every workplace, and it's got different responsibilities on there. Okay. So because we're looking at the key areas of health and safety first, what we're going to look at is it in a much broader sort of term, and then we'll move on to those responsibilities of workers and employers afterwards. So for question 32 on page 67, okay, so your first question is question 32, and it says outline 4 key areas of health and safety related to a work setting. So what I'm going to do is just talk you through some of these. So your first example is fire safety, okay? So when you're in work, there'll always be somebody or a few people who are designated fire personnel, okay? They could be classed as a fire warden. There may be different names for them, but they're there to sort of help with the health and safety of fires, okay? So we must make sure that the person who is responsible for fire, if they're a fire warden, that their training is up to date and they know what to do, because it's going to be that person who has a responsibility for fire safety in the workplace. The next one says moving and handling. So we need to make sure that we are safe to move a child, to move a baby, if we're working with adults, to move that adult, okay. So when you're working in adult care, there is lots and lots of equipment that can help you. You get things like sliding sheets, so you can help to move somebody up the bed or turn them over and things with those. You'd be trained on that. Hoists, so hoists are those sort of mechanical machines where you have a sling with the person in it, and then the person's sling is attached to the hoist itself. I don't know if my action is very good here. But you can obviously have a look on YouTube there as well at a hoist, H-O-I-S-T. Wheelchairs are a way to move and handle someone. Push chairs for children as well. You've got to think about your back. So if you are lifting children, if you're working with babies, if you're working with toddlers, preschoolers, you know, no matter what age they are, they've got some weight there, so you need to protect your back, so you've got to follow your manual handling training. First aid, so we can only give first aid if we're a qualified first aider, okay? If you're not a qualified first aider, you can't do it. If your training is out of date, you can't do it. There must always be a first aider in the workplace. Security, so in nurseries they have the doors locked, normally on like a magnet lock, okay? Obviously that's there to keep the children safe, to stop them from sort of getting out and things. If we think about sort of adult care, there may be some freedom of movement allowed, depending on sort of the setting that they're in. If we think about sort of dementia care, again, we go to those magnet locks to make sure that those people using that service are safe. Disposing of hazardous substances. So a hazardous substance doesn't have to be medicines and drugs. It could be dirty nappies, used pads, things like that. So making sure that there is adequate disposal methods for those. So using, the correct bin. Again, you'd be trained on that. Medication training. So a key area of health and safety. Obviously, you cannot give medication unless you are trained. You also need to follow the rules of the dosage and what is written out in that chart there as well. And if you're unsure, you need to be asking for help from someone senior. Infection prevention and control. So that's your last point there. Infection control is there so that people obviously don't get poorly. We've got this virus going around at the minute, haven't we? And people are washing their hands like frantically, and that is, to prevent infection spreading. So that's a key example there. But it doesn't have to be just that example. You can think about, making sure you're washing your hands after you have changed your nappy, making sure you're wearing gloves and aprons to do personal care. Sounds basic, because it's something that you'll do every day, but it is there for your health and safety, for your safety, as well as the service user that you're working with. So I'll just go through that list again. So fire safety, moving and handling, first aid, security, disposal of hazardous substances, medication administration, and infection control. So what you need to do for question 32 is to write about 4 of those. So you can just do 1 sentence per box. So you've got 4 boxes to write examples in, and that's on page 67. So you can pause this video now to get that completed. For question 33 on page 68, it says outline 3 employers' responsibility for health and safety. Okay. You've got a box for each one. So employer responsibility 1, employer responsibility 2, and employer responsibility 3. So that way we're going to have 3 sentences on the page. So 1 per box is fine. So employers' responsibilities for health and safety in the workplace. Normally at this stage we would give out a poster which should be displayed in every workplace, but I don't have that with me right now. Think about what your employer is responsible for. So if we think about sort of current situation, the employer is responsible for getting in hand sanitizer, hand wash, aprons, gloves, masks. Yeah, so getting the equipment that is needed to safely do your job. Yeah, so we call that personal protective equipment. For short, we call it PPE. So that's personal protective equipment. Okay, PPE, you might hear it called. So that covers everything like aprons and gloves, masks, those types of things, hair nets if you're working in hospitality and things. Employer responsibility 2. So employer responsibility 2 is to make sure that the workplace has a policy in place for health and safety. The employer must provide a policy for health and safety. Employer responsibility 3. Your employer must give you health and safety training in the workplace, and they cannot charge you for it, so it's free. So your employer must give you free training on health and safety in the workplace. There are some other ones that we can think about as well. So they have to provide you with drinking water, they have to provide you with toilets and washing facilities. They also have to have insurance in place. There's lots of things your employer needs to do. So that should help you to answer question 33 on page 68. So if you haven't finished that yet, pause this video. And that brings us on to question 34. Outline 2 workers' responsibilities for health and safety. So the difference here is this is your responsibilities in the workplace, not your boss's, but yours. Okay. So there are quite a few things that you have to do in the workplace as well. One, you have to follow the health and safety policy. If you do not follow that policy, you are going away from what you've been told to do. Number two, you have to follow the training you've been given. If you do not follow the training you have been given, you're making your own decisions, you're putting people, yourself at risk of doing something wrong, making a mistake, hurting somebody, hurting yourself. Number three, you have to think about whether your workplace is safe. So are the things that have been put in place keeping you safe? If they're not, it is your responsibility to pass that on to your employer or to the health and safety manager in your workplace, because if you don't tell them that you feel unsafe and something happens, they may not have known that that was the case, so you've failed in reporting it. Another one, you have to think about your own health and safety at work and your colleagues' health and safety at work. So an easy example to explain here is if there is water on the floor, wipe it up. If you're not wiping it up and then your colleague comes along and doesn't see it and they slip over and they break their leg, that can be down to you for not reporting it if they find that you knew and didn't clean it up or didn't report it to be cleaned up. Okay, so that's the end of question 34 there. So I've given you a few workers' responsibilities to work with. So if you can now answer page 69 and then pause this video until you've done that. Okay, so on page 70, you have question 35. It says, give 4 examples of health and safety training required to work in the setting. So if we're thinking about you working in a nursery, in a school, in a residential home for children, in adult care, it is so important that you are trained in various different things. So first from the top, let's think about risk assessments. It's okay me telling you that you need to follow risk assessments. That's one of your responsibilities. But firstly, you need to understand those risk assessments. If you look at a risk assessment, it is just sort of box after box of information. There's no set format. Different employers use different formats. So it's so important that you are able to interpret that data. What does it mean? What does it say? What does it say we cannot do? What does it say we can do? Sometimes you may have to write your own risk assessment. So perhaps it's, children using the bicycles outside and it's a little bit wet. Maybe you have to write your own risk assessment based on that. So risk assessment training. You need to be trained in using risk assessments, in reading them and in writing them. Hygiene hazards. So you need to understand what to do if there is a spillage, and you need to understand what to do in terms of cross-contamination. So you could be working around food. So if you're working in adult care, in hospitals, in nursing homes, if you're working in nurseries with children, there's always, lunches and snack time and things being given out. We need to make sure we are not cross-contaminating anything. If we are cross-contaminating, we're putting people at risk of severe diarrhea, through food poisoning and sickness and things like that. So we need to be trained in hygiene hazards. Infection control. So infection control is a huge thing when you're working in any care setting, no matter what age you are working with. It is so important that you are caring for those people and those children in the best way that you possibly can, and preventing them from infectious diseases and viruses, and to stop you from getting it yourself and spreading it to others as well. So you need to be trained in infection control and understand how to protect yourself and others. You need to be trained in fire safety. You need to understand what the evacuation procedure is. They usually will do drills with you, so you understand sort of where to go and what to do. Obviously, if you were working in a hospital, that wouldn't be a feasible option when you've got lots of patients sort of hooked up to oxygen and things. So there won't be drills, but you should have some quite serious fire training as part of your induction process. Hand washing. I feel like lately all we do is talk about hand washing, but it is so important. People feel like it is such a basic thing. Now, we all know that we should be washing our hands for 20 seconds, which is 2 lots of happy birthdays. But just don't forget the basics. Yeah, they should be training you in hand washing and observing your technique and things to make sure that you are doing it correctly. And there's no time like the present to explain that for itself than now. Okay, so I'd like you to give me 4 examples there. So you can give me 4 examples from the list I read out. So we've got risk assessments, hygiene hazards, infection control, fire safety, and hand washing. So that should help you to answer question 35 on page 70. If you're still writing, please pause this video now. Okay, so page 71, question 36. It says, what is meant by a risk? Okay, so the risk is the effect of a hazard. Okay, so the risk is the damage that a hazard can cause. So in terms of thinking about this, we have a hazard that could cause harm, such as chemicals. I'm going to put you on this screen actually. So a hazard is anything that may cause harm, such as chemicals, electricity, working from ladders, or even an open drawer. The risk is the damage a hazard can cause. It's the chance, high or low, that somebody could be harmed by these hazards, together with the indication of how serious the harm could be. And this is from the Health and Safety Executive online, so the government-led advice. Okay. So you can pause it back on that screen there if that helps you to answer it. So the risk is the effect of the hazard. It's the chance that somebody could be harmed by a hazard. An example of a hazard, things like chemicals. So if we think of a chemical, it could be that you are cleaning the worktop with some multi-surface solution. You're cleaning with a chemical there. So that is your hazard. The risk of that is that you could get it on your skin and it could burn you. Okay, so that's the effect of that hazard. You could be changing a nappy or changing a pad when you're working in care or with children. The hazard is that dirty nappy, that dirty pad. The risk is that you'll get an infection from that. So we're going to move on to question 37. So on 37 it says, give 4 examples of hazards in health and social care or children's and young people's settings and their associated risks. So hazards, you could have hazards such as people not following their training. If people are not following their training correctly, then they are making up their own rules and they are putting themselves and others at risk. So you could have hazards, not following training, and then associated risks, harm to themselves or people they are or children they are caring for. An untidy working environment. So if the nursery is left very untidy and there's wires hanging out and there's maybe toys left out from the day before, then children are going to run in very excited and they're going to slip, trip and fall over. They could break bones, they could fracture themselves, they could bang their heads. There's lots of different risks that could happen there. There could be a hot drink left on a table. If a child comes along and takes that hot drink and pours it over themselves, they're going to be scolded. The cup could land on their head as well, so it could cause a head injury. So the hazard would be the hot drink. The risks would be scolding or hitting their heads with the mug. Medication training. So medication training, if somebody is giving out medication and they're not trained, so the hazard would be administering medication. The risk of that is that somebody could give the wrong dose, so they could give too much or too little medication. They could also administer it without putting gloves on, and you can absorb that through your skin. Cleaning with chemicals, if you're not taking the right precautions, you could burn your skin. So the hazard is the bottle of chemicals and the risk is burns or itching, yeah. Okay, so that should help you to answer question 37 on page 71. You can also think about your own examples there as well. I know some of you have done childminding at home before, so perhaps you can think of some as well. So pause this video if you're still working on question 37. Question 38 says, what is the purpose of a risk assessment? Outline the purpose of a risk assessment. Okay. Now this is in 4 stages really, so it's to identify the risk. So we're looking for what that risk is. So we've looked at the hazard, we're looking at what the risk is that we're going to be harmed by that. We're going to assess the risk. So we're going to think about how could that risk hurt us? Will it hurt everybody? Like electricity could hurt everybody. Yet a hot drink on a table is only going to hurt some people, because to identify who may be harmed. So I've kind of covered that already a little bit, but it could also help you to think about others that are around you. So if it's fire, for example, other people could be harmed. And to identify ways of minimizing that risk. So those 4 steps: identify the risk, assess the risk, think about who may be harmed, and minimize the risk. Okay. So if you think about it in terms of changing a light bulb whilst using a step ladder, the risk of going up that step ladder is falling off of it. Think about the age and the ability when assessing the risk. So if the person is a builder and they go up ladders each day, then the likelihood is that they're probably going to be okay, but they need to make sure perhaps they've got someone next to them or that they've secured that ladder to keep it safe. Who may be harmed? So making sure that the person using the ladder is away from sort of young children at the time, keeping young children out of the room, because if that person falls off the ladder, that young person's going to be harmed. And I've kind of covered the last section there already, the ways to minimize the risk. So, you know, making sure the ladder is out securely and safely, and having somebody beside them for a bit of extra support if that is needed. Okay, so that should help you to answer 38. So when you're answering it, you can say the purpose of a risk assessment is to identify the risk, to assess the risk, to see who could be harmed, and to minimize the risk. Okay. Question 39 says, identify at least 3 occasions when a risk assessment is necessary. So you need a risk assessment when you're doing lots and lots of different jobs. Okay, so one of your first jobs when you enter that nursery in the morning is to make sure that all the fixtures and fittings are secure, that there's no broken tables or chairs. Even though you've probably done this the night before, it is down to you to sign off to say this is a safe place for children to learn in today. You also need to make sure that there are no sort of needles in reach or sharp tools or anything like that that could be used, say, you know, if there's a type 1 diabetic child in the nursery, because they're obviously a risk as well. You need to make sure that medications are out of the way. So risk assessments are needed for medications, for making sure the room is safe to play in, for working with children who could become aggressive, who have maybe, you know, a special need or a learning disability. You need to have a risk assessment for moving and handling, for when you're lifting children, for when you are pushing children in pushchairs or wheelchairs. So you can use some of those examples that I've given you there. You just need 3, and that should help you with question 39 on page 72. Question 40 on page 73. Question 40 says, outline the importance of protecting your own security and security of others in the work setting. For this question, reflect on security in adult social care settings or a children's and young people's setting. You must outline 2 reasons why security is important in the workplace for yourself and for others, and to show what consequences could happen if security is not in place. Okay. So on the slideshow, we actually gave you some scenarios to work with here, okay? So you are the key person for a 3-year-old called Jack. Jack is usually collected by his mother or his father at the end of the day. You are told by a colleague that his Uncle Andrew has come to collect him. You have not met Jack's uncle before, and when he was dropped off this morning, Mum did not say that anybody else would be collecting him. What would you do? How can you protect yourself and Jack in this situation? And why do you need to protect yourself and Jack? So why can't we just let Jack go off with Uncle Andrew, just like your colleague said? So what we need to do is check that if there is any telephone messages. We need to check to see if Uncle Andrew is on Jack's list of people who is authorised to collect him. There may be a password that you could ask Uncle Andrew when he arrives. We need to ring Jack's mother and father. And if you've got any doubt whatsoever, you cannot let this child leave with this person. Okay. So when you're working in a nursery, it is important to check and identify anyone who is not responsible for a child and that they have permission of the main carers to give their child to that person's care. So in this case, we need the parents' permission to release Jack to Uncle Andrew. Now we need to say about the consequences of this, okay? So the consequences that could happen in this case, it's going to prevent Jack from potential physical abuse, emotional abuse, okay? Yes, it's worst case scenario. However, this is what could happen. You know, Jack could be kidnapped, he could be a stolen child, he could be human trafficked. And it is something that we need to take very, very seriously. The next scenario says you're working in a care home for people with dementia. A maintenance man has arrived to fix the ceiling after a leak a few weeks ago. You were not expecting him today. What danger could happen to yourself as a staff member? What danger could happen to the service users? What can you do to make sure he is meant to be here today? So, in terms of that scenario, so because you're in a residential care home for people with dementia are generally in a care home that has locked doors with magnets on, okay? Now, if you do not follow your procedures in the workplace, you're going to be liable for any of the consequences that happens to the service users who are in your care. So we need to make sure that we are following the procedures in the workplace. So every procedure will be slightly different. The person might hurt you or the service user if he is not who he says he is. So if this maintenance man was not due today, then why is he here? And did anyone even book him in? It's a confusing situation. So we need to ask your manager or your team leader or your colleagues if they've organised the visit. We need to check his ID and we need to telephone the company that he works for to check that he is who he says he is. So when working in a residential home for elderly service users, it is important to check ID of any visitors or maintenance people and that they have authorised entrance. This helps prevent physical harm to staff and residents and the loss of medicines, equipment and personal belongings. So the reason that we're talking about their medications and equipment and personal belongings is because quite often people will break into care homes, often posing as people that they're not actually, authorised to be, and they will steal. Yes, but controlled medications are under the roof there, aren't they? Things like diazepam that people want to get hold of, sedative drugs and things. So what I'd like you to do is to think about those two scenarios. So the first one was about Jack and the second one was about a care home for people with dementia. And it is so, so important that you get across the consequences of what could happen if security is not in place. So you can revisit what I just said about by rewinding this video, and I'll give you a chance to write up question 40 on 73 now. So pause this video here. 41 on page 74. Outline the importance of safe moving and handling principles. For this question, you must outline the importance of following the principles of moving and handling objects, equipment, or persons or children safely. You need to use 2 examples of the effect on the health of employees and the people or children who need support with moving when these are not followed. So what that question is asking you for is the consequences of what could happen if we are not safely moving and handling the person or child. So when we're thinking about safe moving and handling principles, we need to ask ourselves, do they need help to move, or can they do it themselves? Does this child need a carry, or are they okay moving themselves? Do they require help or supervision? Maybe they just need supervising. Have you told that person that you're moving them, or are you just moving them? How heavy are they? Are you healthy and strong enough to move them? Is there anyone who could help you? How long will it take to move this person? Is there enough space around you to move this person? Are there any obstacles in the way? Are you going to trip over? Are you wearing suitable clothing and shoes, for example, if you're on a slippery or damp surface? So if a person is being moved, but the correct procedure is not followed, you could physically harm one. Let's think about it in an adult context, okay? Because we're going to do one adult context and one child context here. So if a person is being moved with a hoist, so being lifted from the bed with a mechanical machine, but the correct procedure is not being followed, then the patient could be harmed. So if you are working with very sort of elderly people, you may find that their skin tears very easily. It's often like tracing paper. You can just sort of rub it here and it will just split. So if you're not using that hoist safely and you have to sort of grab them, because you know we don't mean to grab people, but we do it out of a worry that they're going to fall, then the chances are you're going to tear their skin. And if you tear the skin, it's going to take a long time to heal. So the patient could be physically harmed if you grab them or if they fall out. And the staff could be harmed as well, because if you are trying to grab somebody or take, then you are potentially going to hurt your back. Example 2 could be if you are working with children and you're playing on the floor. So let's say you're playing with some cars on the floor. If you are bending over without bending your knees or without getting right down onto the floor, then you are going to be straining your lower back. So really, to follow those safe moving and handling principles, you need to make sure you are on the floor. If that child has to be picked up, you should always bend your knees to pick that child up. Without bending your knees, you're putting the weight through your lower back. Okay, so that should help you to answer question 41 on page 74. We'll move on to question 42 on page 75 now. So identify 4 accidents and 4 sudden illnesses that may occur in health and social care, children's or young people's settings, and then identify who may deal with these in a work setting. Okay, so accidents that could happen. So we could have cuts and bruises, we could have bleeding, broken bones, a child or adult could hurt their eye, they could bang their head, they could fall over and cut their knee and get grazes, they can graze the palms of their hands, they can bang their nose, scrape their forehead, make their chin bleed. There are so many ways that we're going to get accidents working with small children in a nursery. Sudden illnesses, so sudden illnesses could be sort of flu, diarrhea, sickness, vomiting, a headache, dizziness, feeling dizzy. It's a bit scary sometimes, isn't it? So who needs to deal with these illnesses and accidents in the workplace? So the answer that we're looking for here, qualified first aiders. Okay, if you're not qualified, you cannot give first aid. So qualified first aiders can give care. Obviously then you can, if it's severe, call 999, you can get access to paramedics, you can call 111 for medical advice. If there's a school nurse, you can get the school nurse around. There may be some carers, some teaching assistants who are qualified first aiders as well. But first and foremost, we need to make sure you are identifying people who are qualified to do that job. Okay. So you should be able to answer all of page 75. So you can now pause while you're... Okay, so page 76, question 44, describe how infection is spread. In your answer, use at least 4 examples of how it spreads. Now, you'll see the table is laid out quite sort of differently here. You don't have to link sort of at the same level here. So if you're just doing it as 2 separate paragraphs, that is absolutely fine. So 45, identify the methods that reduce the spread of infection. So examples of how infections spread. So infections are spread by not washing your hands frequently. We know that at the minute because we are hearing it all the time. Wash your hands, okay? So because we're saying describe, you need to write that as a sentence. So infections can be spread by not washing your hands properly. Other ways infections can be spread are not properly cleaning and dressing cuts and grazes. So if we are leaving those cuts and grazes open, we are making it easier for an infection to get in there. So using plasters or bandages to cover that up. Another way that infection can be spread is coughing and sneezing without washing our hands afterwards, or coughing and sneezing without using the tissue and binning it. So the NHS advice says catch it, bin it, kill it, and that is precisely the way to stop infection from spreading, by doing that method. Okay, so that's another one. Another way that infection is spread is cross-contamination. So I spoke about this a little bit earlier. If there is raw food around cooked food, the chances are that the raw food is going to contaminate the cooked food. If the cooked food is then eaten, it can spread an infection. So ways that we can reduce the spread of infection. So that to reduce the spread of infection, we need to wash our hands properly. We need to make sure that we are giving medical care to cuts and grazes by covering them with plasters and bandages. We need to make sure that we are covering our mouth and nose when sneezing and coughing. And we need to catch it, bin it and kill it. We need to make sure that we are not mixing raw foods with cooked foods. We need to use different chopping boards and knives for those. So that should give you all the information that you need for 76. So just remember, where it says 4 examples of how infection spreads, you're going to give me that in sentences, and you can talk about washing your hands properly. You can talk about cuts and grazes needs covering. You can talk about sneezing and coughing. You can talk about cross-contamination of meats and foods. For the methods that reduce the spread on the second box, you can talk about washing your hands properly by singing happy birthday twice. You can talk about dressing those cuts and grazes and making sure they're covered with plasters and bandages. Covering your mouth with coughs and sneezes and catching it and binning it and killing it, and not mixing raw foods with cooked foods, and making sure you're using different chopping boards and things. Okay, so that's 76 done. On to 77. So on question 77, you actually have the NHS method of washing hands, okay? So probably the best thing for you to do is to actually go online and have a look at that poster, okay? So that poster is fully available. This is literally the NHS guidance of how to wash your hands, and all we've done is just taken the words out. So for each step, you can just tell us what is going on in that picture. So you can do your own research on that one. I think that's the best way to do it, rather than me talking through it, because you can see that one for yourselves quite easily. So that will cover for 77. So that if you want to make a note of that, on the top of here, just above your question, just write Google NHS hand washing poster. Google NHS hand washing poster, and that will really help you to answer that question. So the last question, question 47 on page 78, says, identify when personal protective equipment should be used. Okay, so personal protective equipment are things like gloves and aprons. Okay, so we need to use personal protective equipment when we are giving medication, because without those gloves, your body could absorb the medication. We need to make sure that we are using gloves and aprons and PPE when we are dealing with raw meats, because in the workplace it is different, okay? So you don't want to get that on your hands. You need to wear gloves and aprons when you are handling nappies or soiled clothing or soiled bedding. You need to make sure that you've got non-slip shoes, especially if you're going to work in a hospital. There's lots of bodily fluids and different things around there, okay? Also, you'll see on the picture there, I've put a sort of little picture on of children wearing high-vises, okay? So they've got their little sort of high-vis waistcoats on there. And of course, that's when children are out and about, because it is so important that they're wearing their PPE so that they are visible when they're out on a school trip. Okay, so that should be it for the chapter 6. I feel like there's quite a lot in that one, but I do quite enjoy the way that this health and safety comes across. I think we can learn a lot from this, and we can take it forward into work with us quite easily, no matter what sector you go into. You know, if you go into health and social care or childcare, it obviously crosses over beautifully, but health and safety across the board is so important in every single job that you could possibly have. So, and I think at the moment with this virus and things going around, it is just so important to highlight the importance of health and safety and of washing hands and of protecting ourselves in work. Okay, so that's the end of this video. Thanks for watching.